PIDs. PIDs. What is a PID? What are pelvic inflammatory diseases? What do you mean when you say you have a PID? Your doctor has told you that you have a PID, and you are asking yourself, really, what do you mean by a PID? In this video, we are going to talk about a PID. Gerard Massa, the health educator, or Musau Gerard Massa are the names of the channel. And remember, if it's your first time on our channel, subscribe so that you do not miss new videos we release every day about reproductive health. So, a PID specifically means presence of disease-causing organisms in your reproductive system, specifically the part known as the pouch of Douglas. If you have been asking yourself what is causing the back pains, what is causing the discharges you are having as a woman, what is preventing you from getting pregnant faster, then it's high time you did what we call a pelvic ultrasound scan. What is a pelvic ultrasound scan? A pelvic ultrasound scan is a special checkup that will be done in hospital by your doctor, also known as a sonographer, and then your doctor will make a report confirming whether you have a PID or you do not have a PID. Many times when your doctor is doing the scan, the ultrasound scan, and then your doctor sees presence of some liquid, some fluid in that particular part of your uterus known as the pouch of Douglas. It is basically that part which is below your uterus. If there's fluid that is noted in the pouch of Douglas, then it means that it could actually be indicative. It is a sign or it is a confirmation that you have a PID. Your doctor who has done the ultrasound scan is going to make a recommendation for you to do further tests. These tests I'm talking about include the urine analysis test or the urine culture and sensitivity test. Your doctor might also request that you do what we call a rapid plasma reagent test. Now, these are kind of a bit complex, but let me simplify them. The urine analysis test, it's a test which actually is done on a small sample of your urine to assess, to see, does it contain things like maybe bacteria? Is it really very thick? And maybe does it contain residues? Okay? In this test, also known as the urine analysis test, this small sample of urine will be checked in three specific ways. The first way is they will look at your urine macroscopically. Your doctor will look at your urine macroscopically. Macroscopically means that your doctor will look at the color of your urine. Your doctor will look at your urine. Does it contain residues or some particles? And then also your doctor will assess for other things like, is it so smelly? Does it have that bad smell? And then of course your doctor will also report on your urine biochemically or under biochemistry analysis and microscopy. Now here, to simplify everything, your doctor will use some special techniques or special instruments. For example, there's a small stick which is known as the urine, which will actually give details on your urine, whether there are white blood cells, the pH of your urine, is it normal or it's abnormal? Because we all know that the pH is an indicator of the acidity or the alkalinity of your urine. So if your urine, which normally should be acidic, is not acidic but it is more of alkaline, okay, your pH is in 7, it is in 8 or even above, then it means that there could be something changing the normal acidity of the urine, okay. And then of course your doctor will do a detailed look at your urine under a microscope. If your doctor does look under a microscope, looking at your urine, doing a detailed analysis, and then your doctor sees things like yeast cells, bacteria, maybe even presence of big fat bubbles, then this could actually mean that there are changes taking place. Most of the causes of a PID are brought about by sexual intercourse with someone who is already having things like maybe syphilis, okay, and then maybe they are also having things like chlamydia, or they are having other infections, for example, maybe even the treponema organism. It can actually bring about many things like syphilis, okay. So when you do the scan, let's say you've done the scan today, as you are watching this video, you've done the scan, and the scan is showing that you actually have a PID. One thing you should take into consideration is that you did not get this PID that very day when you did the scan, okay? PIDs, pelvic inflammatory infections, can exist in a woman for a long period of time. PIDs can only be confirmed by doing a pelvic or gynecologic ultrasound scan. Remember, if you have any questions, you would like to consult me, you would like to talk to me more about your health, about reproductive health, you have tried to get pregnant and things are not working out, you've taken Clomid, you've taken all the drugs that have been given to you by your doctor, and you are not getting pregnant, please feel free to come to my WhatsApp. I think it is up in the corner there, or it's below this video. Just get in touch with me on my WhatsApp, and then we shall talk more. We shall talk more about how you can get pregnant. If you are within our country, Uganda, you can come to our health facility for a one-on-one consultation. If you are outside Uganda, you can still get my fantastic ebook I've written about how to manage all this, how to manage PIDs, how to get pregnant very fast, how to stimulate your ovaries so that they actually are ready for fertilization, and then how to make things like Clomid work faster for you. You can get my ebook. It is actually very available in many marketplaces, but remember, you can get it very easily by contacting me on my WhatsApp, or you can go to the link below this video. We are proceeding with a PID. PIDs can be identified by doing a pelvic ultrasound scan. When you do the pelvic ultrasound scan and your doctor tells you that you have a PID, you've done the urine analysis test and it's also showing presence of bacteria, you go ahead and do the serum RPR test, that is a test for syphilis. Still, it shows that maybe the syphilis. Then you will actually know that what caused the PID in the first place was the syphilis, or it was that persistent or that chronic UTI you've been having. Okay, so if you are asking yourself, what should you do? You are asking yourself what you need to do to get rid of this PID. It's very simple. Remember, self-medication is not good. So you need to work hand in hand with your doctor, who will recommend the best treatment for you according to what the results are showing. Okay, but the most important thing you need to note is that if the tests show that you have syphilis, or you have chlamydia, or you have treponema, then drugs will be given to clear this from your system, and then you'll be fine. But remember, to heal, to get better from a PID, you actually should be able to treat even your partner, your sexual partner. If your partner is not treated, then there are high chances that you might get reinfected. There are high chances that you can get the PID again. Omsau Gerard Massa on YouTube is the name of our channel. And remember, on this channel we do create awareness about fertility and reproductive health. Do you have any other questions about your reproductive health? Would you like to know more about fibroids, about how you can get pregnant faster? You have irregular periods, but you are asking yourself, what should you do? Remember to ask me all your questions down below in the comments of this video. You can also get in touch with me on my WhatsApp, and then we shall talk more about how you can get pregnant faster. Maybe you have a question and you'd like to talk with me one-on-one in privacy, okay, for confidentiality issues. Then reach me on my WhatsApp, and then we shall talk more. And once again, thank you for watching this video. Thank you for giving us some of your time and investing in watching this video. I hope you've understood something about PIDs now. I hope when you've done the ultrasound scan, now you know what your doctor means when they say you have a PID. Let me see you in my next video, and remember to watch all our videos if you are more interested in knowing more about your health as a woman. And of course, also this video is watched by men. So if you are a man and you are watching this video, your partner has been complaining of lower abdominal pain, and then they are actually having other issues, failing to get pregnant, then get in touch with me on my WhatsApp and let's talk more. Thank